in a case of mucinous cystadenoma. This case was done with a 3-year-old with primary infertility of 6 years duration. She presented with a 2-year history of abdominal pain and swelling, and also volunteered a history of weight loss. On examination, though she was well preserved, there was evidence of weight loss. There were no other remarkable findings on general physical examination. On abdominal examination, the abdomen was tense with a largely cystic, non-tender mass which was equivalent to 40 weeks gestation. There was no ascites. Ultrasound done after consultation revealed features suggestive of mucinous cystadenoma with a strong differential diagnosis of mucinous borderline ovarian tumor based on the honeycomb appearance. She had these basic investigations, and within 5 days, she had exploratory laboratory, largely because of the findings on ultrasound scan. Remember, this patient is coming from the hinterland, so this is of benefit to these patients. So this is a video of the case. This is the bladder. This is the multilocular cyst, but not this area. At times, when one has this clump of mucin in cases of mucinous cystadenoma, they may appear and be confused as solid lesions. So the bladder, part of the vagina, the cervix, and not this huge multilocular cyst which extends from the pelvis up to the Cystadenoma. Not the low level echoes here, and the ground glass echoes in these large cysts. Not the stretched out uterus there, the honeycomb appearance here. Also not the regular septation, which is in keeping with a benign lesion. The honeycomb appearance. I've discussed this in another video, whether it's a pupillary projection or not. So I will not go into the details of this in this video. So you can see the differential echogenicities of the locules, which are features of mucinous tumor. So here on the still image, you can see what looks like the honeycomb nodule, which is a feature of mucinous borderline ovarian tumor of the gastrointestinal type. Here, not the differential echogenicities. Here is a ground glass content. Here again you have another ground glass content, but not the low level echoes in some of these locules. These are features consistent with mucinous tumor. Here you can see the uterus is stretched. You can see the fundus of the uterus are tapered here. And look at this lesion posterior to the uterus, pushing the uterus upwards. And so you can see the uterus is close to the skin here. Not also the uterus here, very close to the skin. This is a 3D rendered image of the honeycomb nodule. And look at the rendered image of the honeycomb nodule, here displayed in different display mode, showing the honeycomb nodule. So this was at laparatomy. You can see the huge abdominal mass. Here, not the uterine, not ovarian torsion. There was torsion of the uterus. So this was the left tube stretched out such that one cannot see its continuation here, only to see the femoral end here. Look at where the femoral end is. The uterus is there in the pelvis. This area was behind the cystadenoma, while this is the area that was within the pelvis, not the surface vasculature. This mass weighed 10.5 kilograms. Remember the ground glass is content here and here, and the low level echoes here. So at histopathological examination, when the last cyst was cut open, look at the content. So this was all bleed. So you can see this ground glass appearance consistent with all bleed. And this was the honeycomb nodule seen on ultrasound. This is the honeycomb nodule seen on ultrasound. And when the honeycomb nodule was cut open at histopathology, note the slimy nature. Content. So here you can see the 2D image of the honeycomb nodule, the 3D image of the honeycomb nodule, and compare this honeycomb nodule with a 3D image. But on gross specimen, look at what the honeycomb nodule appeared like. More like a bunch of grapes. So final diagnosis was Mucinous Cystadenoma. So what are the take-home messages from this case? Yes, this patient presented with weight loss, but the weight loss was not due to a malignant condition. It was due to the huge nature of the mass, which did not allow her to take adequately. Honeycomb nodule is a feature commonly seen in patients with mucinous borderline ovarian tumor of the gastrointestinal type. But as is seen in these patients, it can also be seen in few cases of cystadenoma. In Nigeria, majority of patients pay out of pocket. This is a patient who came from the hinterland. There are challenges, especially with withdrawal of fuel subsidy in Nigeria, the long distance, and where the patient will stay when she comes to the city. So one can see how the pathologic condition in this condition help narrow down this diagnosis to mucinous cystadenoma with a strong differential of mucinous borderline ovarian tumor. Now, based on this, we avoided unnecessary investigations. Even the investigation that would be thought to be necessary, the CA125, wouldn't apply much in this case. Why? Because CA125 is mostly normal, or is often normal in patients with borderline mucinous tumors. Secondly, at the time of the consultation, CA125 was not done in the specialty hospital, so the patient would have to go to the teaching hospital with all the logistics to do this test. Thirdly, it takes time because this test will have to be pulled around at the same time. So because of the pathologic condition in this case, we avoided all these unnecessary investigations and unnecessary delays, and the patient had surgery within 5 days of presentation. So thank you very much for listening.